Hi there, my name is Natalie Metcalf. I'm a registered nurse here at Privé Med Spa, and I perform the CoolSculpting treatments. Today we have the beautiful Mallory here with us. We are CoolSculpting her lower abdomen today. CoolSculpting is the #1 non-invasive way to get rid of those stubborn fat bulges that you can't get rid of with diet and exercise. And the great thing about CoolSculpting also, like I said, it's completely non-invasive, but there's absolutely no downtime with it whatsoever. So Mallory can go back to doing her daily activities today. She can work out today, whatever she feels like. So with CoolSculpting, with each treatment, it usually eliminates about 20 to 25% of the fat cells in that targeted area we treat. Which are eliminated from the body. That usually peaks in about 2 to 3 months. So Mallory will start noticing in about 4 weeks some of the changes. Are you excited, Mallory?
Yes.
Yeah. So Mallory will have a little bit of kind of bloating and swelling for the next 3 to 7 days in her abdomen. She could be a little tender in that area too. That could last for a couple weeks, as well as a little kind of awkward numbness that may hang around for a couple weeks as well, but it's all very temporary. If you do bruise easy, you could bruise with it as well. So, Mallory, we have already done her before pictures. I've already assessed Mallory to come up with the best treatment plan for her to eliminate those stubborn fat cells. And so as you can see here, we have marked Mallory's belly, exactly where we are going to place that applicator so she can get her absolute best results. Mallory, the first thing that I'm going to do is I have a little wipe that's going to kind of wipe off the area that we're treating. So I'm just going to kind of get you positioned here. We're going to pull that down just a little bit, and I'm just going to wipe the area. So the next thing that we do is I have a very sticky gel pad that will go on her abdomen, and this will help protect from any frostbite or injury to your skin. All right, so this part it just kind of uses suction. It's going to feel a little funny. It's just going to pull that area right up into the applicator here. And Mallory, I'm just going to have you take this arm and just kind of move that behind your head for me, just while we get you hooked up. All right, so we're just making sure that we line up the applicator really well with the area we're treating. There we go, sorry, a little pressure. And it's going to pull that, I call it the fat pad, right up into the applicator here. So we haven't turned on the cold yet. I'm going to make sure that I stabilize the applicator with a little pillow here. So we're turning on the cold part now of the applicator. It's going to get cold really quick. You're going to feel a little kind of tugging, pulling. She might even feel like a little kind of stinging sensation. It's almost like holding an ice cube up to the skin, how it kind of burns a little bit. And then after about 6 or 7 minutes into this 45-minute treatment, that area's kind of go numb, and the rest of the treatment for Mallory will be much more comfortable. So Mallory, when this is finished, when your 45 minutes is up, we'll take off the applicator, and then we'll massage out the area. It's kind of like it almost looks like a frozen popsicle or a frozen kind of stick of butter. We massage that out, and that massage actually increases efficacy 60 to 70%. Now we'll just let Mallory kind of sit here and relax and wait for her treatment to finish. All right, we are back here with Mallory. Her treatment is now complete. So we are getting ready to take off the applicator. And then we are going to do a 2-minute massage in this area, which helps increase the efficacy 60 to 70%. So we are going to remove your pillow here. So this looks kind of funny when we take off the applicator. You can see that it almost looks kind of like a frozen stick of butter, frozen popsicle. So we'll take off the gel pad here. And then I'm just going to take a warm little wipe here and just swipe around it before we do the massage. All right, here we go, Mallory. So sometimes this part of the treatment is a little bit more uncomfortable than the actual freezing part, just because it's warming back up to body temperature. But it's also the most important part of the treatment other than the actual freezing. So like I had said before, Mallory's going to be a little bloated, a little swollen for 3 to 7 days. She's going to have a little tenderness in this area, which is completely normal. And then Mallory's just going to want to make sure that she's drinking plenty of water to help keep her system flushed. And then we ask our patients to do a light massage a couple of times a day for the first couple of weeks. All right, so I am going to finish massaging Mallory, and then she'll be ready to go.